My name is Alexis Romero, and I will be presenting on ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. Essentially, the spine begins to fuse and become stiff like bamboo. It may also affect joints like the knees, ankles, and hips, as well as the SI joints, where the pelvis and the hip meet. The cause for ankylosing spondylitis, or AS, is unknown, but those who have a family history of AS are more likely to develop the disease. You can get tested for the HLA-B27 gene. However, not everyone suffering from AS is also going to test positive for the same gene. A CT scan can be performed to confirm further if you are suffering with AS. More men are diagnosed with ankylosing spondylitis than women. Symptoms can be seen as early as 17 and as old as 45 in both men and women. Symptoms can appear as radiating pain in the lower back, hips, neck, and abdomen. Pain often worsens when sitting or lying down for prolonged periods. Inflammation increases in the joints and the build causes the joints to ache. Inactivity allows the pain to settle. Feeling fatigued or even having a fever is a common occurrence. The immune system is overactive and it's creating white blood cells that attack the joints. More severe symptoms can lead to heart disease, Crohn's disease, IBS, and uveitis. Uveitis is inflammation in the eye, which can cause cataracts or glaucoma. There are no known cures for ankylosing spondylitis, so the medications that are used are help to manage the symptoms. Most times, it's not really to manage the pain, but to slow the progression of the condition. So NSAIDs, or non-steroidal anti-inflammatory drugs, are often used to help manage that pain. Disease-modifying and anti-rheumatic drugs are also used. Biological therapies and steroids are also treated to help the condition. So it can be in pill form, like Xeljanz, can be in an injectable, like Taltz or Humira. For the NSAIDs, like naproxen or like a strong leave. It is not normally recommended for ibuprofen to be used long term, but it is also prescribed in some cases. As far as how it affects individuals, families, and communities, it is a very large and impactful disease. For an individual, it's very debilitating. It can be challenging to move around. It's hard to get up in the morning. It's hard to stay asleep at night. You are often having to get up and move around to relieve some of that ache and pain. So it can be very challenging to go to work. It can be very challenging to go to social events. For me, I suffer from ankylosing spondylitis, and it's when I'm having a flare-up during stressful times, it's hard for me to get up and down stairs. It's hard for me to sit down. It's hard for me to lay down. So trying to reduce some of the stress is very ideal. For my family, unfortunately, I have to depend on them quite a bit to assist me when I am having a flare-up, which can be very disheartening at times because you feel like your body is kind of betraying you for not doing the things you expect it to do. So it's good to have family and friends that support and care about your well-being, that are there and willing to help. It's not a disease I would recommend or hope for anyone to suffer from, but it is out there, and it is, in my case, a genetic thing. My father had it, my grandmother had it. It was something I was expecting to have. So be kind to yourself. Be willing to try things you normally wouldn't. I swim. I'm trying to live a healthy lifestyle now because the best treatment for this condition is to live a healthier life. Doing something athletic like Pilates, which I'm trying. Not my favorite thing, but I am definitely trying. Yoga is also really good just to help stretch and loosen up the spine. Following an anti-inflammatory diet. It's really hard to follow any kind of diet, but living a healthy lifestyle is the best thing for this kind of disease, and that's probably going to be the best treatment anyone can have, much like any autoimmune disease. So I hope this was somewhat informative, and I hope you guys understand where I'm coming from. I'm happy to answer as many questions as possible. So thank you.